With that said, I would like to move on to the next presentation. Now, there was a question about managing pain and blood pressure, and that's a perfect segue to discuss about how managing pain and social elements of pain using mindfulness techniques and stress reduction can not only achieve good blood pressure control and good heart health, but also manage other things like chronic pain. One of the things nowadays recommended as a standard treatment for chronic pain these days is um, therapies that are directed at mindfulness and stress reduction, right? So to address the importance of stress reduction in heart health, next we have Carol Penfield. Carol is a lifestyle medicine provider at Emerald Physicians. She received her bachelor degree in nursing from Boston College and graduated summa cum laude from Northeastern with a Master of Science degree. She's been a certified adult nurse practitioner by the American Academy of Nurse Practitioners since 1994. Carol is also an American Council on Exercise certified personal trainer with extensive training in clinical nutrition. For the last 6 years, Carol has specialized exclusively in lifestyle medicine, which addresses healthy behaviors that can improve and sustain health with proven evidence-based strategies. Carol has teamed up with me at Emerald Physicians in offering our newest service line of offering group visits or shared medical appointments that we are now offering for managing weight, managing diabetes, which is we kicked off a new series this January. And if you're ever anybody if you're interested, you can reach out to Emerald Physicians phone number in the main line if you need to sign up for a group visit for these areas. And Carol today will discuss about the importance of stress reduction for heart health. Without further ado, Carol.
Me okay? Can you hear me okay? Okay. Why doesn't everybody stand up just for a moment? Just for a moment. And if by any chance your bladder is stressing you out right now, feel free to go to the bathroom if need be. Just a little movement. Okay, so if you have no stress in your life, you can remain standing. Okay, everybody have a seat. As you know, we are not immune to stress. We all have stress in our lives. And it can be good stress and it can be bad stress. So good stress of having a baby or getting married, hopefully that would be good stress. Or a bad stress, which would be illness in the family or death in the family. But we all end up having stress in our lives at some point. And so I'm going to talk a little bit about how to manage that and how it affects your body. So also we have a different perception. Some people over here may think something is stressful, and some people over here may think that something isn't stressful. So if all of a sudden I threw a snake in the middle of the room, even non-venomous snake, some of you might just scoot out to the periphery, and some of you might be curious and want to take a little look and maybe pick it up. So for some, that's a stressful situation, and for others, it may not be. But it definitely has an effect on our body. So another is when you're sitting in a movie, a scary movie, and all of a sudden you feel your heart racing and you get all nervous and you realize, I'm just sitting in a chair. Why is this happening to me? So that will bring us to my first slide, which is the stress response. And thank goodness we have it, because it's an autonomic nervous system process, and ultimately your fight or flight or your sympathetic nervous system is what really drives all those feelings that you get when you have your heart racing and you get nervous. So that's available because just in case that snake is now out of the room, but now a wild boar comes in and decides to chase you down, you want to be able to survive and run out of the way. So the body has an amazing ability to dilate your pupils so that you can see the exit sign, maybe help release the extra sugar in your body that's there as a resource just in case, and or maybe your heart starts to race in order to feed the muscles so that you can run out the door. On the flip side, we have the parasympathetic nervous system, I guess I should learn how to do my little button. Here we are. Which brings us back to rest, homeostasis, and balance. And that's what we want to try to focus more on when we're trying to manage our stress response and trying to have more relaxation in our lives. So another example here, it's sort of interesting to note that humans are able to produce stress all on their own. It's amazing how we can do that. Take the zebra. The zebra might be going down to the river to have a drink. I don't think he woke up that morning saying, gee, I wonder if the lions are hungry. Or I'm wondering if the zebra next to me can outrun me. Or does that zebra have bigger or smaller stripes than I do? So it's interesting that we have the ability to bring that on ourselves. So it's not just physiological, but other components. So as we think about that, how is that affecting our health? So at the bottom there, we all sort of know that stress has an effect on our health. We've learned that for many years. I've been studying it for a long, long time. Not just blood pressure and cholesterol, but diabetes and elevated blood sugar, and the list goes on. But even more so recently in the medical literature, and they're studying more about our chromosomes or our genes, and how do we turn them on and turn them off, and how stress affects that. So it shortens our telomeres, which are the ends of our chromosomes, which are directly related to our longevity. So now we have more objective data that we can really look at the stress response, how stress is affecting our health, and work from there. So how do we know we're managing our stress effectively? Well, all we have to do is relax. Well, that's not the... Did I give you a shortened up? Do we not have the triangle? Okay. Yeah, that's not the one, but maybe I can go forward more. There we are. Somehow it's a little mixed. No worries. Won't stress me out. Okay, so we just have to relax. How many times you just said, oh, I'm just going to relax? Maybe it's not that easy, because sometimes it might involve the body. So your body may be tensed up. Sometimes your mind might be busy and you're having a difficult time relaxing the mind. But even the third dimension is your spirit. And so maybe you feel like you're a relaxed person, don't have a lot of stress in your life, but you may not really have that sense of purpose or that drive or feel miserable in other ways. So you want to take a look at all of these and sort of figuring out which aspect of this you want to work on yourself. So we're going to take that on next. So the first is your body. A lot of times people will find that they're holding tension in their neck and shoulders, which is what we're going to take on first. So everybody sit up at the edge of your chair. We may not find that we're going through life like this until someone tells you that. So sometimes we may not be able to just let that part of our body relax. So let's just bring our shoulders up towards our ears, tighten them up, just hold them up there, tighten them, tighten, 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 and just let it go limp and down. Let's try that again. Up, squeeze those shoulders, up towards those ears, tighten, tighten, and then just let it go. And one more time for good luck. Up, nice and tight, 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 and then just let it go. So for any of you that find that you're really holding tension and stress in your neck and shoulders, that's a great little technique that you can pull in at any time. A lot of people try progressive relaxation, starting with your feet, letting the feet relax, the ankles relax, the calves relax, the knees relax. But often you might be sitting there going, I can't seem to get that body part to relax. So that technique you can kind of throw in there and just tense up the body and then try to relax again. So it really helps with that style. Next is breathing. Now often when we go and get our blood pressure checked, we put our arm out and we say, wait a minute. Okay, take my blood pressure. A lot of times we just sigh. So that breath, that taking the breath in and out, Now we automatically breathe, thank goodness. We wake up every day breathing. But we also have a way of manipulating that breath. So that's why a lot of focus of relaxation techniques involve the breath. I mean, our heart might race during that scary movie or when the snake's in the room, but we don't have a lot of control over what's going on there, but we do have control over the breath. So that plays a nice role in relaxation. Physical exercise are already touched upon. Certainly exercise muscles relax better. Tai Chi, yoga, Qigong, all wonderful ways of moving the body and focusing on the body. Biofeedback, massage, self-massage, that all sounds wonderful. Reiki, acupuncture, etc. Then we have the mind, and that's really where mindfulness and meditation come into play. We're going to next do a little exercise here, incorporating both body movement and then also our mind and thought process. So taking the breath and the body. But as you focus on that breath, what you're trying to do is just get rid of the everyday chatter in your head and bring yourself to the now, bring yourself into focusing on what you're trying to do in the moment. So now we're going to sit up at the edge of our chair. And connect our mind and our body a little bit. So the same fear. Oh my goodness, there's me on the skin. So we're place our hands on our thighs. We're up at the edge of our chair. And we're just going to curl the lower back, let the head drop gently. And now come up nice and tall and send the chest forward, open up the chest. And we're just going to curl. So this is just a usual cat-cow. And all the way up, arch the back. Now let's add some breath. Exhale, curl. Inhale, come up. Take a nice deep breath in. Exhale, curl. Inhale, lift through the top of the head, open the chest. Exhale, curl. This time for 4. 2, 3, 4. Inhale, come up. Exhale, curl. 2, 3, 4. And come all the way back up. And just rest. Now, I didn't take a lot of time focusing on your breath just then, but a typical way to start with just adding breath into your life or practicing that with the relaxation technique is usually a 2-to-1 ratio. So you inhale for 4 and you exhale out for 8. So let's try that. Inhale, 1, 2, 3, 4. Exhale, 2, 3, 4, 5, 6, 7, 8. Now do it at your own pace. In for 4. And exhale, 1. And one more time, in for 4. And exhale. Okay, good. Now some of you close your eyes, which is very nice because you can also take out the visual distractions. We live in a world now that is busy. That woman is a perfect example of being on the phone and on the computer and trying to figure out what to eat for dinner and trying to get to work on time. It's become a very busy, busy life of ours. So just taking time in the moment to just calm the body and relax through that breath. That breath is with you all the time when you're driving and you're in horrible traffic or you're waiting to have your blood pressure checked in your doctor's office, what have you. Can always use that. Some people like to use guided imagery where they just pick a place that brings them joy and peace, the beach, or sitting on a hammock on the beach, or being on the top of a mountain, or somewhere that brings you peace. Just closing your eyes and putting yourself there often can be just enough to help start that relaxation response. Self-hypnosis brings it just a little step further. Cognitive behavioral techniques, that tends to be done in a psychotherapy setting. Cognitive is going with what you're thinking, your thoughts. Behavior is what happens as a result of those thoughts. So working on the thought process that's leading to the behavior that you want to change. So psychotherapy is excellent at that. Music also is wonderful. But I do recommend it not be heavy metal. They have studied that heavy metal isn't quite as relaxing as the symphony, which probably is no surprise to all of you, or new age music. Problem-solving techniques, and of course, humor plays a wonderful role as well. So lastly, we're going to take on the third part of that triangle, and that's our spirit. Now this is a tricky little area because that means something to everyone very differently. So looking at self-compassion, looking at gratitude, looking at how you connect with other people. We are really clan beings. We belong with our clan. That helps us survive these thousands of years. So being isolated away from that is not helping our health or our stress levels. So looking at how to socialize and stay involved with other people, have friends, get out in the community, make a difference, figure out what drives you every day. If you figure out what drives you every day and your passion, it really will guide you towards making healthier decisions, much more motivating than fear and angst. And lastly is forgiveness. I'm just going to touch upon this for a moment. I finally watched the movie Unbroken. Or anybody read the book or watched the movie Unbroken, which is about a gentleman who unfortunately goes down in his plane and survives 40 some odd days in a life raft and happens to be picked up by the Japanese and then survives living in a Japanese concentration camp. That right there is a stress beyond my comprehension. Goes home, survives all that, has a long life, goes back to Japan to forgive his captors. Still gives me goosebumps. He then, interestingly enough, lived to age 97. So where in that picture get that man healthy? He handled all that stress for all those years. You would think his telomeres would be very shortened, yet he lived to 97. So I'll just let you ponder about that just a little bit. Okay, so I'm going to, in summary, talk about ways to relax and distress. So I sort of combined the information I gave you. I gave you a longer list, but now I'm bringing it into a little more of a doable list for people who aren't as comfortable with meditation or relaxation techniques. So you can find a technique, or maybe you can look at possibly going with an activity. So we pretty much touched upon everything on this left side. Meditation, prayer, deep breathing, imagery, progressive relaxation, stretching that fits in the whole category of yoga, etc. Finding some way, maybe one of those makes sense to you for you to try or maybe add on to. On the other side, are you really putting it into action form, going out and exercising more, taking more classes or stretch class, or coming up with something that you can do at home. Some people like to get relaxation tapes. There's a million out there. I'm dating myself, maybe a CD or an app or something that you can download. Distraction. So distraction is quite a powerful one as well. Going to a funny movie, and you just took care of two of those under your activities category there. Petting animals. They're now studying more and more how animals are therapeutic. Nature watching, we're in a perfect place to do that. The beach is a beautiful, beautiful place, even in the winter, even if it's raining. And again, music. So one note to self here. If you choose bathing or a bath, a nice warm bath, note to self, don't add too much bubble bath. So the literature is looking at how long does it really take. That's always the big question. But I recommend now really to start to work towards, if you can, 10 to 12 minutes a day. Anybody doing that now? Yeah, excellent, good. So all of you have a little work to do. So I'm going to stop there, and happy to welcome any questions, or we can pass it on up to how do you wish to? Two questions. Yes, sir.
At a previous session, they had talked about breathing inhaling through the nose. What are the things they talk about? Hold or not?
Mm-hmm. Great. That's great. Right. So he's talking about breathing in and out through one nostril and then to the other. It is one form of yoga breathing, working on right brain, left brain. Some people might find that stressful, that feeling trying to breathe in and out of one nostril or the other. Some people might find it stressful trying to follow breathing in for 4 and they find they can't breathe out for 8. So you have to find one that's comfortable for you, and I'm glad you did. Yes, in the back. So she's asking about the length of the telomeres, of whether they're predetermined or can they lengthen, correct? Based on, right. They are as, do you want to answer that one? Okay, good.
The telomeres, I don't know, for those who don't know that, chromosomes are the packaging where the genetic material is packaged in each cell, in the tissues, in the organs in the body. So that's the way of kind of how the genetic information is packaged, whether somebody has a risk for breast cancer, whether somebody is going to have blue eyes, or, all of that genetic material is packaged in chromosomes in each cell in the nucleus. The way that is arranged structurally, it has a tip to it. If you imagine the shoelace, everybody imagine a shoelace. The tip of the shoelace is wrapped up in the plastic. That's how the tip of a chromosome is wrapped up, and that tip is called telomere. And we're all born with a certain specific length. It may vary for individuals. However, as we age, as degeneration happens, as the bodies and tissues takes hits from all the stresses, physical, mental, the length of the telomere, the length of the tip of the shoelace in our analogy starts to become shorter and shorter, and that is correlated with aging. So if somebody's, the tip of the chromosome becomes shorter faster, that person is going to age faster. So doing a healthy lifestyle, using colorful fruits and vegetables, plant-based diets, mindfulness techniques, meditation, has shown in studies to actually maintain the length of the telomere, or at least slow down how fast it becomes shorter. And that's the way to kind of slow down aging. It doesn't become longer. That was the question. It doesn't get longer. It can slow down how fast it gets smaller. Does that make sense? Thank you. So thank you so much, Carol. That was very useful to do that. Thank you.